Hello and welcome to our podcast series, Conversations with KidsPeace. I'm Bob Martin. When it comes to training the next generation of caregivers in the mental and behavioral health care space, KidsPeace presents in many ways a unique experience for medical professionals at the beginning of their career. The collaboration we have with institutions involved in this training is a classic win-win scenario. Our kids benefit from their passion, excellence, and energy, while the practitioners get the experience in a real-world continuum of care. This year, KidsPeace will be providing that experience for the first time to members of Lehigh Valley Health Network's fellowship program in child and adolescent psychiatry. The first of these physicians, Dr. Joseph Venditto, recently completed his 4-week rotation at KidsPeace's Orchard Hills campus, and he sat down with us to discuss that experience. Here's our conversation. Dr. Venditto, welcome to the podcast.
It's good to be here. Thank you.
Oh, it's great to have you. You are the first doctor to do a rotation at KidsPeace as part of the LVHN Child and Adolescent Psychiatry Fellowship Program. Is that correct?
Correct, yes.
Now, can you briefly explain the role that this fellowship plays in your training?
Oh, sure. So, well, it's a little complicated. Essentially, the Child and Adolescent Psychiatry Fellowship, it's 2 years in total. But for a good chunk of that rotation, we do need some inpatient experience. That is to say, young kids who have are struggling with mental health who actually come into the hospital. So our primary rotation at LVHN is actually their inpatient psychiatry unit, but they only take as young as 12-year-old kids up until usually 16, 17 years old. So predominantly our exposure there is more so older adolescents, but KidsPeace accepts children of a more wide age range. So the unit I was at, we actually saw as young as 6 years old. So that kind of completes the the age range, if you will. So that's why we'll be at KidsPeace for right now about a month, but that might be a little bit longer in the future, but we'll have to see.
That's amazing. I hadn't thought of that, but obviously it's something that you have to take into account that, some places you're just not going to get the full range. So you need to be able to take a look at that.
Correct.
I understand that you grew up in Bucks County.
Correct.
So
yes.
you're sort of local here to our location here in Pennsylvania. Did you always want to pursue a career in medicine?
Yeah. So I think high school is when I was making that decision. Part of me wanted to become an author and do something more creative. But my uncle is actually a physician. He really enjoyed his job. He's actually a pulmonary critical care doctor, and every time I saw him, he always had great stories to tell. He just seemed like he seemed so satisfied by his life and his career. So that's why that kind of pushed me more so into the direction of medicine than in college, because usually before you go on medical school, you complete usually an undergrad career out of college, and you take pre-medicine classes, and I really enjoyed my classes. And I got decent enough grades, so I kind of cemented my path to applying and attending medical school.
What was it about psychiatry, and specifically child and adolescent psychiatry, that interested you as a specialty?
Right. Well, so just because it's a little bit convoluted, so I'll just give a little history here.
No, please.
So first you do usually 4 years of undergrad, then you attend 4 years of medical school. Then in your last 2 years of medical school, that's when you start to apply for a specialty, essentially. That could be family medicine, psychiatry. Psychiatry is 4 years, and then once you complete your general adult psychiatry residency, you do 2 years of child and psychiatry as a fellowship. So initially, I was thinking more so adult psychiatry. I was in medical school, mostly because this might kind of harken back a little bit to my high school days of kind of like a little bit more of a, not really artistic, but I liked how things were a bit more open in psychiatry. As I say, with a lot of other medical specialties, usually, you get a good history, but of course you get some blood work, get an x-ray, you have a pretty good idea of what the diagnosis is. Psychiatry needs a little bit more work. You really have to, interview the patient, maybe interview the family as well. So you need that humanistic touch, as well as you need to be a good detective, essentially, to kind of get all the information you need to really put everything together, hopefully get the right diagnosis and get the patient the treatment they need. So I thought that was much more intellectually stimulating than some of the other rotations I was on. And then during my adult psychiatry experience, I found that just my own personal style, I felt I did quite well with the younger kids, and felt like I was pretty good with, talking with parents as well, because parents, need to get a huge chunk of history from them and also offer them, the assurance they need that, their child's going to be okay.
Absolutely.
So I felt that I kind of clicked well with that, and that kind of cemented my path towards pediatric psychiatry.
I think in our previous conversation, you mentioned something about being kind of a puzzle solver kind of thing. And it sounds like that's part of what you need to take into account, especially when you are talking about the younger kids who may not be able to tell you clearly what's going on.
Yeah.
Now, can you give us an overview of the activities that you engaged with when you were doing your rotation here at KidsPeace? What was that day like?
Yeah. Well, essentially, every day, it kind of depends on whether the patient was new or a follow-up patient, whether they've been there previously. If they were a follow-up like they were previously, usually I would check on them in the morning, talk with the nursing staff, see if there were any concerns overnight, see if maybe their family called with any questions. And I'd like to spend some time talking with the kids, seeing, how the therapy is going, if there's any side effects from medications. And sometimes still, especially if the diagnosis is in question, I want to spend a little more time with them, try to get a little bit more history, because again, when you first meet a mental health doctor for the first time, they ask you some very personal questions, and they might not want to, there's some things they want to talk about right away. So you have to gain their trust, essentially. So that's kind of what the mornings look like. And then the afternoons we'd follow up with any needs that they have. Also, we want to touch base with our clinicians as well, make sure they have good outpatient follow-up scheduled. Again, see if the parents have any questions, maybe even call the parents with updates, let them know things are going well, that sort of thing. And if we had a new patient, usually I like to have at least an hour to spend with them in the afternoon, have some time to talk with the family as well to kind of get all the pieces of the puzzle I need to take the first step in their treatment. Okay. So if that kind of answers your question.
Yeah, absolutely. And that brings me to another question I was wondering about. You've completed your rotation at KidsPeace. What are some impressions of that experience you think you'll take with you as you go forward in the fellowship and in your practice?
Right. Well, again, I think every place has its strengths and weaknesses. So I always like to focus on the strengths and see how, especially as I go on to either the outpatient or inpatient setting, what are those strengths I can bring along with me. So here, I really like that there's people work together well as a team here, the clinicians, the nurses. So I like that. So that was kind of one of the strengths that I noticed here. And also, like I said before, we see younger kids here at KidsPeace and Lehigh Valley Health Networks, and kind of how we talk about how those symptoms present themselves and how the kids express themselves is quite different. So it's kind of good to know how these kids present at every age. So that's another thing I'm taking from here from the younger kids.
Oh, it's interesting. I remember my kids being young and having to explain to a teacher that my youngest was whatever she was telling you was right. It's just she's probably not saying it right.
Correct. Yeah.
But she's not lying to you. If she says she saw something, that kind of thing. One of the things that we deal with here, and I'm sure they're dealing with it at LVHN, there is a nationwide shortage of psychiatrists. And I'm wondering, as someone who is practicing in the field, are there things the society could do or do better to try to address this shortage?
That's a really good question. I think overall we're making some progress in the right direction. As I said, to become a psychiatrist, it's a very long process, and there are some rate limiting steps along the way. The good news is that we are opening up more psychiatry residencies and child and adolescent psychiatry residencies, which means more medical students who are interested in pursuing psychiatry will have those avenues. So that's good. But again, there are some issues along the way, like, for example, inpatient facilities, for example. They're few and far between. We have a lot of folks who come out from hours and hours away, especially in some of the lesser populated counties in Pennsylvania. Not only do they not have inpatient psychiatry, they don't have psychiatrists, period, for their kids. So that's an issue. Especially more and more, I know, talk about funding for medicine in general at the federal, even state level is a concern. So I think in terms of offering more avenues for psychiatrists, and even right now we're dabbling more with nurse practitioners and PAs, I think that's a step in the right direction. There's more work to do. Again, the specific answers.
Well, it's one of those things. It took us a long time to get to have dug this hole. It's going to take us a while to get out of it, but the quicker we start, the quicker we'll get there. So, and I think, as you pointed out, programs like the residencies that are going on, KidsPeace is part of a number of those programs, and of course the fellowship programs is just part of our effort to try to address some of those issues or start us on the process of getting those issues addressed. Right. So. We end each of our interviews on the podcast with a request for a life hack. Now, this can be a, favorite saying, an inspirational quote. Maybe it's just a tip on doing something around the house a little bit better. So, what's your life hack for us today?
My life hack. I would say one thing that's been pretty consistent with me throughout my life is the expression that the only thing worse than no data is bad data. Because basically, if you make a decision, a choice based on information that's incorrect, you're going to get a bad result. That's the same, in psychiatry, making a diagnosis, starting, treatment, or really probably apply it to most other fields as well. So that's one I really kind of stuck to.
Yeah, that's good. It's good to remember, especially because every day you're doing so many decision making so much decision making in your life. Make sure you have the right information, or at least make sure you're okay with the information that you're getting. And,
correct, yeah.
And then you kind of roll the dice at that point.
Best you can do, yeah.
Dr. Joseph Venditto is in the Child and Adolescent Psychiatry Fellowship Program at Lehigh Valley Health Network here in Pennsylvania and just completed a rotation with KidsPeace as part of that program. Dr. Venditto, thank you for joining us both in your residency and here on the podcast.
No problem. Thank you, Bob. I appreciate it.
And thank you all for joining us as well. We'll look forward to having you join us again for more conversations with KidsPeace. Until then, take care.